My talk was about malpractice, which is when we fail to appropriately provide our patient with the appropriate standard of care. I was highlighting for especially the young radiologists these mistakes that can lead to this style of practice, especially in our field, the breast imaging field. Mistakes lead to either missing a cancer, which is very harmful, of course, or may delay the diagnosis, which also may delay the treatment for our patients. That may mean it's more aggressive surgery and treatment and lower the survival rate chance. I think like it's some keywords that's related to this malpractice. Some of them lead to this style of practice, like for example, when we are not obtaining enough data, clinical data, this may lead to inappropriate next step for our patient. Also, another keyword is the re-reviewing the previous images and the previous studies of our patients, so we can come to the conclusion to what's the appropriate next step. Communication is a very important part that not many pay attention to it, and it's lead to mistakes and malpractice. Communication of the radiologist with the patients, with also the physician and the rest of the team is very important point to come all of us like a team with the appropriate next step for our patients. Also, I highlighted a very important point, which is auditing. It's the way that we as a radiologist assess our performance and check if we are getting enough cancer detected, or if we are doing over diagnosis, like doing more biopsies than it's necessary. This is how auditing can help radiologists to assess the performance, and accordingly they can see how they can enhance this performance by different ways. For example, one of the important ways is double reading, where a lot of institutes get each mammogram to be read twice, so make sure no more cancers are missed. Auditing is one of the when we established the Breast Imaging Society, one of our main goal was to put in Egypt a unified standard of care regarding the early detection and mammography, and ensure that Egyptian women get access to the early detection programs. We are still in the phase of establishing, but we are very hopeful to have it sooner, because in North America they have the Mammography Quality Act, which is ensures that the quality of early detection and mammogram is optimum for early detection of the cancer for our patients.